I would actually like to ask you some questions about HG just because
Oh, sure.
I messaged you about it and was like, come on and talk about this because I know you personally about it. And then I was like, oh no, I have to ask you a bunch of questions about a bunch of stuff because it's
That's
just
okay.
what
I'm
you do.
happy to
Like,
come back.
yeah,
So,
like you know so much stuff. I was like, I gotta like pick your brain. But first I want to ask, like, how do you tell the difference between HG and just regular morning sickness? Is there like a telltale sign or is there just you just case by case?
it's case by case. It's you treat it on a step-by-step basis. So the first rule of thumb with morning sickness that may or may not be HG is, first of all, there are general guidelines to follow. Everybody's are different. But the first rule of thumb is whatever works, that's what you do. I've had mothers say to me, my grandmother makes me milkshakes and those work. I'm like, well, then keep drinking those milkshakes. You know, in general, the advice that we give mothers, we start out from lowest intervention to higher interventions. You know, they need to keep hydrated and they need to keep calories going in. So we talk about small, frequent meals, stay away from greasy foods, foods that tend to trigger your symptoms. We talk about not letting your stomach ever get total, you know, you don't want to get over full, but you never want your stomach to get totally empty because then you're going to get even sicker. We talk about drinking water. And then here's where I tend to break away from the standard advice that we give to mothers. Sometimes, and you experience this too, Danielle, everybody's saying, drink water, drink water, drink water, drink water. And water makes you sicker. So what I was taught working for Ilir, who is now Optum, is drink drinks if you're not a diabetic. That throws a whole new chink into it, that have some sugar in it, like Gatorade, Powerade, Kool-Aid, lemonade, you know, anything where that sugar can grab those water molecules and drag it down into your gut without it coming right back up. Because when your stomach is so upset from everything else that's going on, the water just tends to kind of sit there and roll around or come back up. And so my advice that I give to mothers, and I guess I have to qualify this with, don't do this if you have HG, check with your provider first, because everybody is different, is what I call my nibbling and sipping. And we did this with you. Just have a bag of high carb snacks near you, cereal, pieces of toast, bagel, crackers, pretzels, whatever works next to you. And every hour, just alternate sips of whatever you're drinking and sips of whatever you're eating, nibbling, sipping all through the hour, so that over the course of an hour, you're maybe getting at least 4 ounces of fluid and at least 150 calories in. And this is only a temporary thing. Like if you feel like you have to do this for more than 2 or 3 days, then we step up to the next thing. There are over-the-counter medications that focus on B vitamins and Unisom that is basically just a substitute for diclegis, which is the big hyperemesis medication out there on the market right now, but it's very expensive and a lot of insurance companies don't cover it. So most practices will talk about a combination of B vitamins, extra B6 during the day, and then a Unisom tablet at night to control it. That tends to work a lot of times. If that doesn't work, if they're in the first trimester, then there are medications that we try. And if they hit that second trimester and it's still going on, there's another medication that we can escalate to. But sometimes a mother is just not coming around the bend. It usually tends to peak. It starts to rear its ugly head right at about 6-7 weeks, and it tends to peak right at about 10 weeks. If it is going beyond 10 weeks, or if a mother is vomiting all day long, she's losing fluid, she's got to get fluids. So I'll send her in for fluids. And sometimes that's just enough to turn things around. If it's going beyond 12 weeks, or it looks like it's going to go beyond 12 weeks, or she's losing weight, or she's not able to keep anything down, then I'll call in a company like Optum and see if one of the hyperemetic pumps is appropriate for her. And I don't want to sound like a walking advertisement for this company. I assume that there are other companies out there that do the same thing. But what I like about them is that mothers have daily contact with a nurse if they choose to have daily contact with a nurse. Optum has pharmacists that are very, very skilled in this. If one therapy is not working, they'll work with the pharmacist, and the pharmacist will come up with another therapy, up to and including steroids, depending on, excuse me, what the mother's condition is. Sometimes they'll say, no, she needs to go into the hospital and maybe needs intravenous nutrition. I haven't seen anybody in my practice yet that's gotten that bad. I do have a few mothers that are continually sick throughout their pregnancy. They get on a pump and it manages it, but once that pump comes off, they're sick again. So it's just a case-by-case basis, and you treat it on a stepwise basis to what works. I think I remember with you weren't even able to keep the other fluids down. So I said, well, send somebody up to the 7-Eleven and see if you can spoon a slushy down. And I think that's what finally did it for you.
Yeah, that helped a lot because I couldn't hold down water. It was really weird. It was really weird because I drink water all the time. So I was like,
but it's not unusual for women who are experiencing this. Yeah. And I don't know if anybody ever told you about this. I just pulled this up on my phone there. There's a website called HER Foundation, hyperemesis.org. And there's a lot of information on there for mothers. There's a lot of information on there for professionals. Lots of good information on there. And then they have sharing forums for mothers so that, women can check in with each other and provide each other with support.
Yeah, I think the support is probably one of the key things I think that got me through it, because it was hearing other women that experienced it or going through it at the same time. And then also having medical people that believe you and are actually trying to treat you, make sure that you're okay and checking on you. I think support is probably one of the biggest things I think to get through it, in my personal opinion, to be honest. It was so scary. And my mom, who had been previously pregnant with 5 kids, and she got sick and whatever, she was like, it's just morning sickness. You'll get over it. And I was like, this is not the same. Like, Gavin was so, I would throw up and I'd just go back and eat and it was fine. But no, it was completely different. And it's a different experience because, nobody believes you. It's like, you have to get out of bed and you have to eat something. And you're scared. You're scared to eat anything. You're scared to drink water. It's a very scary experience. I don't know. Those were probably some of my darkest hours, because I feared losing another baby during that at the same time. Because now it was like, I thought we were dying. I was like, I'm going to die. He's going to die. We're not going to make it. I really, truly believed it. So yeah, that's why I reached out to you, because I was like, you have to explain this, because I think too many people are not getting the support. We need support to get through it. And I'm sure back in the day of the history of what happened before medical care, we probably lost women and babies this way and didn't, it's just not part of our history that we talk about. I'm going to take my guess on what I've thought about and what I've, looked into, whatever. And then my experience was, it was horrible. So
it's just morning sickness. You'll get over it.
Some ginger.
Yeah, what's that? I'll try some ginger.
Have some ginger. Yeah, that's it. I heard that a lot.
People, it works, but ginger is kind of hard to come by. Ginger candies, lemon candies. There's ginger ale, but do you know how hard it is to find ginger ale that has real ginger in it?
That's true. It's all artificial.
You find that it tastes like it's awful. So and that doesn't always help either. Now, those things work kind of, sort of, for women that are having morning sickness, which for a lot of women, they don't realize it. They'll get sick at night instead of get sick in the morning, because their body is slowing down, and that's when their body is going to show these symptoms. But so, those things might be helpful for your run-of-the-mill morning sickness, but they're not helpful for hyperemesis.
And see, my first pregnancy with Gavin, I actually had those, I think they're like Preggy Pops or something like that. I don't know what they were. They're like the little sucker, whatever thing. I did those. I popped those probably most of my pregnancy, because I was a smell person. If I smelled anything, I would immediately just start, I couldn't hardly hold it. I remember I worked at a casino, like going by and like throwing in a garbage, like throwing up in garbage, and there's a camera over me, and I'm like, oh, freaking, I work here. This is so embarrassing. Like, I was like, oh, and I'm like going to the bathroom and like getting cleaned up. I brought a toothbrush with me, which then when I was pregnant with my rainbow, a toothbrush was evil. Oh my God, a toothbrush was so scary. I was scared to brush my teeth because if I even touched my tongue, if I did anything, I was throwing up, and I was like, I just had one. I mean, it's gone. Like it didn't matter. I was like, I can't hold anything. It was so bad.
Yeah, that's a
Just
big
so
piece of
so
advice that I
different.
give to mothers, about, and when I'm talking, usually when this is going on, I'm talking about just your average run of the mill morning sickness, prop yourself up on an elbow, have a little bit of something to eat, snack on, sit up, get up slowly, start going about your day. Don't go straight into the bathroom and brush your teeth. God, no. That's the biggest way to start yourself off. Wait until you've got a little bit of food in your system and you've gotten acclimated to being upright for an hour or so before you go and try brushing your teeth, because that'll set people off.
Oh yeah, for the rest of the day too. It's the beginning. That's once you start. Like if you slept and you wake up, once you start, it doesn't stop. Like it will just continue for the rest of the day. It doesn't matter what you do. It doesn't matter if sometimes laying down, you're like the room is spinning. Like I spent so much time being nauseous. Like I think I thought the world was like, I was like this, like for a long time. Like, I really want to say like, it was like after he was born, maybe I was like, oh my gosh, I'm normal again. It's a weird experience to feel like you're just like swimming in water or something. It was very, very, very weird. Like, oh my gosh.
Sometimes it just takes sending somebody in for a liter or two of fluids, and that'll help them turn the corner. Another thing that I found out, and you might laugh about this, but so we used to use it before the first trimester, but now we try to wait until after the first trimester, at least until after 10 weeks. But Zofran is kind of the drug for hyperemesis. Well, Zofran is very constipating. And pregnancy in and of itself is very constipating. And I remember there would be times when I'd be on the phone with mothers at Optum and going through everything that they've been doing and thinking, what else? And then I would think, wait a minute, how long has it been since you've had a bowel movement? And some mothers would say, a week, 2 weeks. And nobody had caught this. Where on God's earth is it considered to be normal that you don't have? Mothers don't seem to know that, oh, I haven't had a bowel movement for a couple of weeks. This must not be good. We'd fix that and they'd feel better because, nothing is going through. So everything is coming back up. It's got to go somewhere. And so there's no one way to approach it for every woman that works for every woman. You just have to look at her life and look at her circumstances and figure out what she's dealing with and how you can work around that. I know some of the nurses that were going into the homes and setting up the pumps would come back and say they need social services in this house. Something has got to change because the house would just be a train wreck. And, and once they got someone in there to help this mother get the resources that she needed and the support that she needed, the symptoms would calm down a little bit. Not completely sometimes, but it was something, so it's approached from a lot of different levels.
Yeah, I could see that. I do remember, if you would have asked me, I probably couldn't tell you because I don't think anything was really staying in my system. So I was like, I don't have to go to the bathroom ever because nothing's like staying in my system. But I do remember when I started actually eating food after I went through all these treatments and all these things and actually could eat again, which was very, very little. I realized I hadn't gone to the bathroom because I could feel it and I was like in pain. Oh. And then at that point, my mom was like, you have two choices. Like my mom pulled like the mom part. You have two choices. Like you're like a little kid, like you're either going to have to figure this out or we're going to have to figure this out or I have to take you in kind of thing. So, so she went to the store and got me like almost everything you could possibly, whatever. And I was like, oh, I'm going to be in the bathroom forever.
That's okay. Get it out.
I felt so much better. And then I was like kind of back to normal. But I do remember and to be honest, because I had a natural birth the first time, and then my rainbow was so different and so not natural. Like in so many ways, I took Zofran and like you know what I mean? I knew the complications of the things I was trying, like all this stuff, but I was like, I just need to survive. But I was actually, it's very interesting, but stool softeners, for whatever reason, I was scared of them. I was scared of stool softeners.
Huh.
And then I don't know if it's just like the natural thing, almost like you're taking like a drug or something, but it's a stool softener. I don't know. But it's like really weird that when I went to have my rainbow, completely different experience. And then toward the end, when I was like planning my C-section, I was like, I told my doctor, I was like, hey, you know, having a C-section and then trying to go to the bathroom after a C-section, she was like, you know what you can do since we have it planned, just start taking the stool softener a few days before. And so it's already in your system. It's all whatever. So when it happens, and I did, and I started taking it just a few days before, not a week, not whatever, just like she told me, just something, whatever. And sure enough, like, I think the day that I had him, I think I went to, and I was like, it was like, oh no, I remember the last time, because no one told me anything. Like, you have a C-section, they give it to you, but they don't, like, they're not telling you, by the way, when you leave here, if you need to take some stool softener, like, you know, nobody told you. So it's interesting, like, thinking about that. Like, I was scared of it when the natural, but then when I got more like medical, I'm like, oh no, you need it. It's just for relief of the body. Like, you know,
Well, you know, surgery is not a natural way to have a baby. So why would you think that you are going to have a natural bowel movement after the fact? Your body has been opened up to the outside air. It's going to clamp down against what it perceives as a threat to itself. And it's not going to do what it would do otherwise, not often anyway. So stool softeners are the way to go. I send mothers home on stool softeners every time.
I've asked, and really weird, but my doctor had already told me about it, and she was like, "Yeah, just do what you got to do." You know, she was really awesome about it. But the ladies at the hospital, for some reason, I asked for it because they hadn't given it to me like the day of whatever, and I asked for it, and the nurses were like shocked, like, "Why would you ask for this?" And I was like, because I've already had a baby and I've already talked to my doctor, and maybe it's even in my stuff that it's probably in my charts that she told me to go ahead and take it before. Like, I'm sure it's all like in the notes somewhere. And I was like, she told me to, and I'm surprised you guys haven't given it to me yet. And then they were like, okay. So then they would come in and be like, apparently you want, like every day that I was like, apparently you want stool softener. I was like, yes, I do. I was like, I'm not going to be uncomfortable with a newborn. Like, I don't think so. Like, I've done this before. I'll never do that again.